Hi, Maria. How are you?
Hi.
How's it going?
I'm okay. I came in to see you because I think I might be pregnant. I wasn't sure. I missed my last period, but I've been kind of irregular anyway. My boyfriend and I have been talking about maybe having a baby, so we weren't using birth control all the time, and now my period is late, so I'm here.
Well, I'm glad you came in today. The test that the nurse did earlier does, in fact, show that you're pregnant.
Oh, God, I'm so sorry. I don't even know. I don't even know what to say.
Tell me, what are you feeling right now?
Um, well, my boyfriend and I were talking about having a baby. Not exactly trying, but not exactly avoiding it either. And the idea seemed really exciting in some ways. But I'm in school part-time and I work the rest of the time, and he's in between jobs. And, well, just thinking of the idea that I might actually be pregnant, it just left us both feeling a little panicky.
Well, it's really common for women or couples to feel panicky in situations like this. Did you guys talk about what you might do if it turned out that you were pregnant?
No, not really. I mean, we've just had so much going on. It's been so... I don't know. I don't know.
Would you like to talk about some of the things that you're thinking about right now?
It doesn't, it feels too much and too hectic. I'm not sure I'm ready to be a mom right now. I God, I'm sorry I'm getting so upset.
It's okay to be upset. Seems to me like you're working through a lot of feelings about this pregnancy.
Yeah, it's so complicated. I also grew up in a family that didn't agree with abortion, and I don't want to have to tell them if that's something I end up doing. I just don't know. I don't even know what I want or what I want to do.
Well, it seems like you're being pulled in a few directions. Tell me, what would be most helpful for you right now?
I don't know. I guess I want to hear about, since I'm not sure I really want to be a mom right now, can you tell me a little bit more about abortion if that's something I decide to do?
Yeah, I can do that for you. I usually start with some general information about abortion. It can be helpful to have more of the facts when you're trying to make a decision. Is that okay with you?
Yes, that would be really helpful.
Okay. First off, abortion is very safe. And about 1 in 3 women in this country have at least one abortion in their lifetime.
Wow, I had no idea it was that common.
Yeah. And having an abortion does not change a person's chances of getting pregnant or staying pregnant in the future.
Oh, that was actually one of the things I was most worried about.
Tell me more about what you're worrying about.
I don't know. I mean, where would I even go?
Well, we provide abortion care here, or I could provide a referral if you're more comfortable going somewhere else.
Okay, that's good to know.
While you're still thinking through things, I'd just like to ask you a couple of questions, which I ask everybody who's making this decision. It sounds like your boyfriend knows that you might be pregnant. Have you talked to anybody else?
Yeah, we just didn't know for sure. I didn't tell my family because I didn't know how to deal with them.
Okay. And, of course, it's okay for you to decide if and how you want to share this, and who you want to share this with. But since you've been discussing being pregnant with your boyfriend, if you choose to have an abortion, how do you think he'd react? Would that be a safe situation for you?
I think he would be sad too. I don't think he'd be angry. I think we both felt so unsure about what we would actually do if it turned out that I was pregnant. I don't think he would try to push me into a decision, and he would definitely never hurt me. You know, the more that I think about it, and with all that we have going on right now, I don't think this is the right time for me to have a baby. And I think that even though I might be sad for a while, an abortion may be the best option for me.
Being sad doesn't mean it's a wrong decision. Being sad is just sometimes what happens. There's no right or wrong here. It's really up to you. Do you want me to keep talking, or would you like some time to talk to your boyfriend or anyone else right now? I mean, I can step out of the room for a bit, give you some privacy.
Yeah, I do want to talk to my boyfriend. But I do think I'd like to have the abortion. Saying all this out loud and hearing myself talk makes me realize I am just not ready for a baby. It's really just too stressful.
Okay. It sounds like you've made a decision. Okay, since your periods have been irregular, I'm going to need to do an exam today to figure out just how pregnant you are.
Okay, that's fine.
Based on that, I can help you figure out your options. You may be able to get an abortion here in our office today, or if you want more time, we can schedule it for later. You may need to go somewhere else, and I can give you referrals for that. If you do decide to do it here, you can have your boyfriend or anyone else you like with you throughout the next steps, if that's helpful for you. How does that sound?
Yeah. Okay. Thank you. This has been really helpful. I'm pretty sure I want to do it today.
Okay. I'll step out now and I'll give you some time, and then we can talk more when you're ready.
Hi, Sarah. Thanks again for talking to me about the abortion I had last week. No one besides my boyfriend knows, and after you brought up your own abortion in class, I realized how much I wanted to talk to someone who had experienced it as well, since it was a hard decision for me to make. Once I knew I was pregnant for sure, I realized it just really wasn't the right time. I'm so glad that I ended up seeing my family doctor because he made me feel so supported and respected. I really felt like he wasn't trying to force me into making a decision right there and then. I was upset and sad through most of my conversation with him, and I really appreciated his saying that it was okay to be sad, and that it didn't mean that an abortion was the wrong decision. And when I finally decided that I wanted the abortion, he gave me time to talk to my boyfriend, and I was able to have the abortion done in the office that same day. I felt a sense of relief walking out and not being pregnant anymore. Both my boyfriend and I still feel sad since we thought we might be ready for a baby, but we both know that it was the right decision for us. Thanks again for letting me share this with you. It's nice to know that other people have made the decision to have an abortion and still feel good about it today. See you soon. Maria.
Hey, have a minute?
Hey, of course. How was the rest of your day?
Good. I'm so glad we had that chat this morning about your patient who came in really knowing she wanted an abortion.
Me too. Did you have a similar patient this afternoon?
Well, not exactly. I actually had a patient who came in feeling conflicted about what she wanted to do.
Really? How did it go?
Well, you know, when someone comes to me and says that they're not sure what they want to do, I often have a hard time not taking over the conversation by giving them all of the information about every possible option they have. But I know that's not always helpful for people. After you and I talked earlier, I just kept remembering to listen to her and to leave space for her to tell me what was most helpful for her in that moment.
Yeah, it's really a challenge for me to take a step back and not bombard the patient with a whole list of options.
Well, during this visit, she was really thinking about why she felt conflicted. She said she felt sad.
Really?
But during the conversation, she became sure that the abortion was what she wanted and decided to do it today. At the end, I felt like I was able to respect her autonomy.
Yeah, I also find it tough to counsel patients who feel conflicted. Whether a patient comes in knowing exactly what they want or if they're totally undecided, they're the ones who know themselves best. And it's our job to listen to that. It's important that we respect whatever decision they ultimately make.
I'm so glad that we can talk about this with each other.
Absolutely.